What if I told you that the very checkups designed to protect seniors after 70 could actually put your health in danger? It sounds unbelievable, doesn't it? For decades, we've been told that regular screenings and routine tests are the keys to staying safe, catching diseases early, and living longer. Doctors, hospitals, and glossy health campaigns all repeat the same mantra, better safe than sorry. But here's the hidden truth almost no one talks about. Sometimes these very tests create more problems than they solve. Behind the white coats and polished medical brochures lies a statistic that should make you pause. Up to 37% of medical tests in seniors lead to unnecessary treatments, complications, or lifelong side effects. Think about that. More than 1 in 3 times, a simple test could push you down a path of anxiety, medication, and even risky surgery without adding a single extra day to your life. And the most alarming part? Nearly 99% of seniors have no idea this is happening to them. They trust the system. They believe every scan, every scope, every test is there to help. But in reality, some of the most common procedures are quietly linked to harm. One of them, and you'll see which one in just a few minutes, is so dangerous that experts estimate it causes 5% of all cancers in the US. That puts it in the same league as drinking alcohol daily. Imagine that. Sitting down for a preventive checkup could be as risky as downing a shot of whiskey every night for years. This isn't about fear-mongering, it's about empowerment, because here's the truth. Modern medicine is powerful, but it's not perfect. And after 70, your body isn't the same as it was at 40 or 50. The balance between risk and reward shifts. What might save one person's life could cause another person unnecessary suffering. That's why in this video, we're pulling back the curtain on the 5 medical checkups you should think twice about after 70. These aren't fringe theories or conspiracy claims. Everything you'll hear is backed by real science, real patient stories, and real statistics that most clinics never bother to share. But before we dive in, I want to hear from you. How old are you? Where are you watching from? Have you ever gone through a medical test or procedure you later regretted? Drop your answers in the comments below. We reply to every single one with personalized advice and tips. And if you want more health truths your doctor might not be telling you, make sure you subscribe and turn on notification. This community is built for seniors who want clarity, not confusion. Now, let's get started. Because the first checkup on our list is one you've probably heard about, maybe even done. It seems harmless, just a quick scan. But for seniors over 70, it can quietly ruin your quality of life. On the surface, a bone density scan sounds like the safest test imaginable. No needles, no pain, just a quick scan that tells you whether your bones are at risk of fracture. Most doctors recommend it casually, almost like they're suggesting an eye exam. But here's the uncomfortable truth. After 70, this test often creates more fear than benefit. The scan, officially called a DEXA scan, measures how strong or weak your bones are. It's mainly used to detect osteoporosis. But here's the catch. After age 70, the results almost always show some level of bone loss, even when there's no real danger. Why? Because bone loss is a normal part of aging. Just like wrinkles or gray hair, it's something the body naturally goes through. The problem is what happens next. Many seniors are immediately prescribed powerful medications called bisphosphonates. These drugs are marketed as bone strengtheners, but their side effects can be devastating. We're talking about jaw necrosis, where part of your jawbone literally starts to die, and painful inflammation in the esophagus, not exactly what you signed up for after a harmless scan. And the kicker? The benefits are tiny. A large study in the Journal of the American Geriatric Society followed over 1,000 women above 70. It found that these drugs reduced fracture risk by only 0.3% after 5 years. That's not nothing, but it's a long way from life-changing. Meanwhile, the risks from side effects are far more common and immediate. Take Rose, a 76-year-old retired piano teacher. She went in for a routine DEXA scan, even though she had never fallen, had no pain, and walked daily. The scan came back with osteopenia, which is just mild bone thinning, not full osteoporosis. But her doctor instantly started her on alendronate, a popular bisphosphonate, Within 3 months, Rose developed severe acid reflux and intense jaw pain. She couldn't even sit at her piano, let alone play. When she finally stopped the medication and focused instead on natural strength training, vitamin D and calcium-rich foods, her health bounced back. A year later, she was performing again, fracture-free and medication-free. The science backs her story. A 2022 Osteoporosis International study showed that weight-bearing exercise, balance training, vitamin D, and diet changes reduce fractures in seniors by more than 20%. Compare that to the 0.3% benefit of medication, and the choice is clear. So yes, a DEXA scan might look harmless, but for most people over 70 who aren't falling, aren't fracturing, and live active lives, the better option is lifestyle. Don't let a number on a screen scare you into treatments you may not need. And as surprising as that sounds, the next test is even worse, because it doesn't just cause fear. In some cases, it can push seniors toward brain surgery. For most seniors, memory slips are terrifying. You forget where you put your keys, or you can't recall a neighbor's name, and suddenly the fear sets in. Is this dementia? That fear often leads doctors to order one of the most overused tests in older adults, the brain MRI. On the surface, an MRI seems like the smart high-tech answer. It shows detailed images of your brain, down to the smallest changes. But here's the problem. In people over 70, most of what an MRI finds is just normal aging. Slight shrinkage, tiny white spots, or areas of reduced blood flow are extremely common. They look concerning on a report, but they usually mean nothing dangerous. And yet, once a scan shows something abnormal, it sets off a chain reaction. Doctors order more tests. Patients panic. Families start preparing for the worst. In some cases, people even end up facing invasive procedures like spinal taps or even brain biopsies, all because of age-appropriate changes that never needed treatment in the first place. The numbers are staggering. A 2021 review in Neurology Today looked at over 3,000 MRIs in adults between 70 and 85 who had mild memory complaints. 86% of scans showed some kind of abnormality, but here's the catch: only 3% of those findings were linked to a treatable condition. That means 97% of people went through the fear, the follow-up, and sometimes the surgery for nothing. Take George, a 74-year-old retired engineer. He came in worried because he was misplacing his keys more often and occasionally blanking on names. His doctor ordered an MRI, which showed white matter changes. The radiologist report flagged it as possible vascular changes, and George panicked. He convinced himself he had dementia. He quit driving, he stopped going to church, his anxiety spiraled, and his life shrank to the size of his fears. Months later, when he finally had a proper cognitive screening test, his score was completely normal for his age. The MRI findings were simply part of normal aging. The truth is, unless there are serious neurological symptoms like seizures, sudden personality changes, or rapid decline in daily function, a brain MRI rarely helps in mild memory loss. What actually works better? A simple cognitive screening test. It's paper-based, takes less than 15 minutes, and measures memory, problem-solving, and attention. It gives a much clearer picture of whether you're experiencing normal aging or something that truly needs deeper investigation. So the next time memory slips make you nervous, don't rush into a giant magnet machine. Start small. A screening test can give you answers without fear, without radiation, and without the risk of being pulled into a medical maze you don't belong in. And speaking of risky mazes, the next test is one that has sent countless seniors into the operating room, often for heart procedures they never needed. If you're over 70 and tell your doctor you feel tired, a little short of breath, or not quite yourself, there's a good chance you'll be scheduled for a cardiac stress test. On paper, it sounds like a smart idea. Walk on a treadmill, or take a medication that simulates exercise while doctors monitor your heart. If something looks off, they can spot blocked arteries before they become dangerous. Sounds safe, right? Not so fast. The problem is accuracy, or rather the lack of it. In seniors, stress tests have a false positive rate as high as 40%. That means almost half the time the test says there's a problem, There actually isn't. But once the results come back abnormal, the cascade begins. Angiograms, stents, even bypass surgery. Each step comes with its own risks, and in many cases, none of it improves lifespan or quality of life. A 2017 study published in JAMA Cardiology found that more than half of all stents placed after stress test referrals were in patients with no clear symptoms and no survival benefit. In other words, the procedures didn't help them live longer, but they did expose them to complications like bleeding, kidney damage from contrast dyes, and long hospital stays. Take Raymond, a 75-year-old retired postman. He stayed active, walking daily around his neighborhood. During a routine checkup, he mentioned feeling a little more tired on hills. His doctor ordered a stress test just to be safe. The results were unclear, so Raymond was sent for a catheterization. Doctors found a mild narrowing in one artery and placed a stent. That night, he had a reaction to the contrast dye, damaging his kidneys. He spent 6 days in the hospital and weeks recovering. Here's the sad part: his fatigue never changed, because the real problem wasn't his heart. He was simply dehydrated and needed more rest between meals. So when should a stress test be used? Only if you have clear classic symptoms: chest pain during activity, shortness of breath with light exertion, or a sudden drop in energy when doing normal tasks. For anyone else, the risks often outweigh the benefits. Better options do exist. A resting EKG can pick up dangerous rhythm problems without putting you on a treadmill. A coronary calcium scan can detect plaque buildup with far less risk of false positives. Both give useful information without pushing seniors down the path toward unnecessary heart surgery. And if you think that's bad, just wait, because the next test is one almost every senior has faced, and while it's designed to save lives, past age 70, it may do the exact opposite. Few medical tests are as dreaded as the colonoscopy. The preparation alone is enough to make people nervous. Strong laxatives, days of restricted diet, dehydration, and sleepless nights. But most seniors go through it because they believe it's the only way to protect themselves from colon cancer. And yet after age 70, and especially after 75, the risks often outweigh the benefits. Here's why. The procedure itself may be safe for younger adults, but in seniors the complications climb dramatically. Sedation used during the test increases the risk of confusion, falls, and even heart rhythm changes. The scope itself can cause bleeding or tears in the bowel, and the PrEP gallons of laxative solution can lead to dizziness, kidney issues, and dangerous dehydration. A massive 2019 study in JAMA Internal Medicine analyzed over 1.3 million Medicare patients over 70. The findings were sobering. For every 1,000 colonoscopies, only 2 lives were saved. But more than 20 patients suffered serious complications. That's a 10-to-1 ratio tilted toward harm. And even when polyps are found, they're often tiny and slow-growing. Removing them in a 72 or 75-year-old with no symptoms may cause more harm than simply leaving them alone. Dana's story is a perfect example. She was a 73-year-old grandmother who ran a bakery with her daughter. Healthy, active, no digestive symptoms, no family history of colon cancer, but her young doctor pushed her into a screening colonoscopy anyway. During the procedure, a small polyp was removed. That night, Dana collapsed from intense abdominal pain. At the hospital, they discovered a bowel perforation, a tear caused by the scope. She spent 9 days recovering, lost 10 pounds, and never fully regained her energy. Looking back, it was completely unnecessary. She had already had 2 clean coloscopies in the past. There was no reason to repeat it. The current recommendation from the U.S. Preventive Services Task Force is clear. Stop routine colon cancer screening at 75. Even between 70 and 75, it should only be considered if you're in excellent health and haven't had a recent screening. For many seniors, a stool-based test like the FIT test is a safer option. It's done at home, has no PrEP, no sedation, and still catches most concerning cases. So if you're over 70, don't let anyone scare you into thinking a colonoscopy is your only option. Ask about alternatives, because once you're in the colonoscopy pipeline, it's very hard to get out, and the risks may be far greater than the rewards. But as risky as colonoscopies are, they pale in comparison to the next test, a checkup that's marketed as cutting-edge prevention but could actually trigger the very disease it claims to stop. It sounds futuristic. Walk into a sleek clinic, step into a high-tech scanner, and walk out with a complete picture of your health. Private hospitals and executive checkup packages market the full-body CT scan as the ultimate preventive tool. But here's the shocking truth. These scans are among the most dangerous tests a senior can get. Why? Radiation. A single full-body CT scan exposes you to the equivalent of 500 chest X-rays. That's a massive dose of ionizing radiation, the kind that damages DNA and raises cancer risk. According to a 2023 modeling study published in JAMA Internal Medicine, the rise of CT scans in the U.S. may now be responsible for up to 5% of all cancers. To put that in perspective, that's the same cancer risk as drinking alcohol every single day. And the harm doesn't stop with radiation. These scans pick up harmless nodules, cysts, or calcifications that are simply part of aging, but once they're spotted, doctors can't unsee them. Red flags go up, more scans are ordered. Then come biopsies, surgeries, and months of fear, often for findings that never needed treatment in the first place. Marcus's story shows just how quickly things can spiral. He was an 80-year-old retired martial arts teacher, still active and healthy. As part of a private elite health package, he agreed to a full-body CT. The scan showed a tiny 3-millimeter lung nodule. His doctors panicked, sending him to oncology, then ordering a PET scan, and finally a needle biopsy. The result? Benign. But the biopsy collapsed part of his lung, landing him in the hospital for weeks. He went from teaching senior fitness classes to struggling just to breathe, all because of a scan he never needed. Here's what experts say. Full-body CT scans should never be used for routine screening in healthy asymptomatic adults. The American College of Radiology has been clear. There is no proven benefit and significant potential for harm. Targeted imaging is only helpful when there are clear symptoms: unexplained weight loss, persistent coughing up blood, or visible swelling. Scanning the whole body without a reason is like searching for treasure with a landmine detector. You might find something, but the damage you cause along the way can be far worse. The safer path is simple: listen to your body. If you feel well, maintain regular checkups with your primary care doctor, and only agree to imaging when there's a clear medical need. Fear-driven testing may sound like prevention, but it could actually plant the seeds of the very disease you're trying to avoid. And that brings us to the bigger picture, the conclusion of everything we've uncovered. So there you have it, the 5 medical checkups that millions of seniors take for granted, believing they're safeguarding their health, when in reality, they may be doing the opposite. Bone density scans that scare healthy people into harsh medications, brain MRIs that turn normal age-related changes into terrifying diagnoses, stress tests that send active seniors into unnecessary stents and bypass surgeries, colonoscopies that bring more harm than good after a certain age, and full-body CT scans that don't prevent cancer, they may actually cause it. It all points to one bigger truth. In medicine, more is not always better. More scans, more procedures, more pills, they don't automatically equal better health. In fact, for older adults, they can sometimes shorten life, reduce independence, and steal peace of mind. The real question to ask before agreeing to any test is simple. What happens next if this test finds something? If the answer involves uncertainty, risky follow-ups, or treatments that won't truly improve your quality of life, then it may be wiser to pause. Because prevention isn't about chasing numbers on a report. It's about living in a way that strengthens your body every day, staying active, protecting your balance, nourishing your body with whole foods, sleeping deeply, and nurturing your relationships. These are the checkups that truly matter, and they don't require a doctor's order. Now I want to turn it over to you. Have you or someone close to you ever been caught in the spiral of unnecessary tests or procedures? Did it create more problems than it solved? Share your story in the comments below. Your experience could save someone else from making the same mistake. And if this video opened your eyes, make sure to hit the like button, subscribe, and turn on notifications. Every week, we reveal the hidden truths about senior health, the information buried under medical jargon and industry hype. You deserve clarity, confidence, and control over your own health. Because at the end of the day, your best years aren't behind you, they're right here waiting to be lived fully, wisely, and on your own terms.